I'm ready.
Okay, so these two branches here are brachiocephalic veins. They dump into the superior vena cava, which is right there. Also dumping into the superior vena cava is this little vein right there, and that's called the azygos vein. It's going to become extremely irrelevant pretty soon. So all these veins dump into the superior vena cava, and the superior vena cava is going to dump blood into the right atrium, which is this first chamber of the heart. Also dumping blood into the chamber is this, which is the inferior vena cava. So you have a superior one and you have an inferior one, makes sense. There are a few things about this atrium you need to understand. So the heart has a giant vein surrounding it right here. That vein is called the coronary sinus. It is the only vein related to the actual heart, like getting deoxygenated blood away from the heart, that we actually learn about for itself. The way it does that is through this red point right here.
So small? Okay.
Yep, that is the ostium of the coronary sinus, which makes sense. Ostium, whole coronary sinus, that vein that we just talked about. Now, the other thing you need to know about the right atrium is that number 55, that white dot right there. Okay? When you are a fetus, that is a hole, and it's called foramen ovale. When you take your first breath, the idea is that hole is going to close. It has some connective tissue surrounding it, and it just closes with the air pressure. As a fetus, that hole is called foramen ovale. When it's closed, it's called fossa ovalis. When people are born with a hole in their heart, that hasn't closed. So now you're starting to understand a little bit more. So the way he usually asks that is he'll tag it and then he'll say something along the lines of, what is the name of the structure as a fetus or an adult? So keep that in mind, because this is a structure that can change its name depending on how the question is asked. Once blood reaches the right atrium, it's going to go through this valve right here. This valve has a few different names. Most people call it the tricuspid. I call it the right atrioventricular. The reason why I like atrioventricular is because this is called the atrium and this is called the ventricle. So just put those two words together and you get atrioventricular. But the reason why it's called the tricuspid is because you see these flaps right here? Those are called valves, or cusps, sorry. Those are called cusps. Tricuspid, this one has 3. On this side, it's the bicuspid because it has 2. So whichever naming convention works for you, just remember one, right atrioventricular or left atrioventricular or tricuspid or bicuspid. This one's also called the mitral valve. The left is weird because it has a ton of names. So now it's in the right ventricle. After it goes into the right ventricle, it's going to make its way up into the pulmonic valve. This is also called the pulmonary semilunar valve. From here, it goes into the pulmonary trunk, where it's going to separate into these blue vessels. These vessels are called pulmonary arteries. The reason why they're called pulmonary arteries is because they're taking blood away from the heart to the lungs. We tend to think of arteries and veins being oxygenated and deoxygenated and all that fun stuff. This is one of the exceptions. The reason why it's blue is because it hasn't gotten oxygen yet, but it is still an artery because it's carrying blood away from the heart, which is the definition of an artery. So once they go to the lungs, they get oxygen, they come back through these red vessels here on either side, and these are called pulmonary veins. They're oxygenated, so they're going to be red, but they're carrying blood to the heart, so they're going to be a vein.
From the lungs?
Yep.
Okay.
Okay. So that's going to dump blood here into the left atrium, where it's going to go through the bicuspid, mitral, or left atrioventricular valve. Again, all of them are correct. And then it's going to go through the left ventricle right here. Once it's made its way into the left ventricle, it's going to be pushed up through this valve here. You can see those like white beads. That is the aortic valve or the aortic semilunar valve, where it makes its way up the aorta to go to the rest of the body. Now, we tend to think of the brachiocephalic artery as being the first branch of blood flow in the aorta. That is wrong. The very first thing the heart actually does is supply blood to itself because it's greedy, just like me. So it does that by having these small branches right here where my thumbs are. So this one is called the right coronary artery, and this piece is called the left coronary artery. The reason why I say that piece is because the left coronary artery is actually going to bifurcate, come straight down and across. When it goes across, it's called the circumflex artery. It actually runs with this vein, which is the only vein we learn about in the heart flow, like around here, and that's called the coronary sinus. This is called the apex of the heart. The reason why it's so important is because it helps you get your bearings. The apex of the heart has 4 arteries pointing to it. So I have one artery here, one artery here, one artery here that's been drawn in, that's the Charby artery, and then this one right here. These 4 arteries you need to know the names of. So if you ever forget how many arteries there are or how many arteries you need to look at, just look at that apex and you'll see 4. This one is called the anterior interventricular artery. Anterior because it's on the anterior side of the heart, interventricular because it's between the 2 ventricles. So this one back here would be called what?
The posterior ventricle.
Posterior interventricular artery. This one here is called the right marginal artery. So what would this one be called?
The left marginal.
Yep,
artery.
just like a margin on a page. It's actually the same name. Other things you need to know. This red right in here is a muscle. This is the muscular interventricular septum because it's a septum, so it separates the 2 ventricles and it's made of muscle. Okay? And then up here is going to be the membranous interventricular septum. So you have a muscular one, which is this dark red, and this light one, which is membranous. Surrounding the muscular interventricular septum, you have these white things drawn in. These white things are called false chordae tendineae. Those will become very important when you actually see the inside of the heart, and you'll understand why at that point. But these are called false chordae tendineae, and then these tendons attached to the valves are called chordae tendineae, and they attach the valve to these red pieces right here called papillary muscles. Okay. The very last thing to cover, it's just one more structure, and it's this one right here. This is called ligamentum arteriosum as an adult, or ductus arteriosus as a fetus. Same reason, foramen ovale and fossa ovalis. So same general question. What is the name of this as a fetus? Ductus arteriosus. As an adult, ligamentum arteriosum. The way Scott always teaches it is it's always SNS or M&M, but never SNM. So the M's go together and the S's go together. Okay, that's it.